Your labs are normal. That is probably the most dangerous phrase in modern medicine. Do you know why? Do you actually know what normal means? It doesn't mean you are disease-free. You are just average. And in a population where the majority of people are metabolically sick, average means you're probably in that bucket too. I've seen this in practice for a long time. These people coming in, they do not look healthy. A lot of weight issues, they're losing hair, they have skin issues, but they come in with their blood values that are normal. Some people are told, oh, you know, it's all in your head. Don't buy that. I mean, the worst thing you could do to someone is give them the wrong diagnosis, and that's definitely a wrong diagnosis. Today, I'm going to show you some really important lab values, and then I'm going to talk about some of the most important things you should know about a blood test and what you should focus on. But what happens with the blood values is just picture like a bell curve. And what they do when they create these reference normal ranges is they basically cut out the low end of this graph and the higher end. So as the population is getting sicker and fatter, these normal ranges are really coming out of that group. In 1997, they changed the normal fasting glucose level. It was 140, and then overnight, they changed it to 126 milligrams per deciliter. So before 1997, you would have to reach a blood sugar level of 140 before you were diagnosed with diabetes. And then, of course, right at this point, if you just had 126, you're diabetic. Overnight, 1.4 million people were diagnosed with diabetes. What's really interesting is that if you look at these trends or graphs of when people had a problem, you will see a lot of diabetic problems that happen over this. And if you don't know this data right here, you're thinking, wow, people are just eating a lot more sugar. Well, maybe, but maybe not. Maybe it's just that they changed the numbers. Also in 2003, pre-diabetic used to be 110. Then after this date, it went to 100. Overnight, 41 million people were diagnosed with pre-diabetes after that. Again, when you're looking at trends and past statistics, you have to have all the data. And this is definitely missing data for a lot of people. And they also did it with cholesterol too, which I think it was in the early 80s. Overnight, millions of people had high cholesterol. And then also with vitamin D. This was done just to look at the amount of vitamin D that you would need to prevent rickets and keep your levels at least at 20 nanograms per milliliter. When they calculated the RDAs, they made an error, which they never corrected. Even now, they have never corrected this error. Because when they did this evaluation and said it was 600, in reality, the true numbers that you need every day to keep your levels at 20 and prevent rickets is 8,895 international units. That's a big difference, right? I know some doctors will even say this amount is toxic. Unbelievable. If you have a vitamin D level of 20 nanograms per milliliter, that is a severe deficiency. That's just my viewpoint. I have a lot of data to back that up. But if you have 20 or less, you are probably suffering from a lot of symptoms that are related to a vitamin D deficiency. One of the biggest problems I see with what doctors test in your blood is glucose, right? They do a fasting glucose test to determine what's happening with your blood sugar. They almost never test insulin. This right here is the biggest blind spot in medicine, okay? You can have perfect blood glucose levels, but have such a major problem with insulin, which is actually made by your pancreas. And literally your pancreas is screaming at you, but glucose is normal. So the most missing test, or the test that is the most important that doctors should be doing, is a fasting insulin test. This hormone right here will be elevated 15 to 20 years before your glucose starts to be elevated. So this test measures how much your pancreas is yelling at you, because insulin is removing sugars from the blood. Okay, normally you should only have like 1 teaspoon of sugar in all of your blood. And so you can imagine an average person consumes a lot of sugar. I'm talking about 50 to 100 teaspoons of sugar per day. So it's like working really hard And you check your blood glucose, and the reason it's normal is because this guy's in the background working like crazy. What is the normal level of fasting insulin? There is no agreed upon number. Okay, so I'm just going to give you my 2 cents on this based on a lot of research that I've done on this. You want your fasting level of insulin to be between 2 and 6. If it's at 8, you should be concerned. If it's between 10 and 12, you're at high risk for developing insulin resistance and pre-diabetes and then diabetes. But some doctors, when they see like 12, they're saying, well, that's normal. It's not. And then this leads us to the next test right here, HOMA-IR. I'm going to try to keep this really simple. HOMA-IR is doing some calculations between a fasting insulin test and also a fasting glucose test. And it gives you a little more information to tell you if you have insulin resistance. This is a precursor to diabetes. HOMA-IR is basically telling you how glucose and insulin are working together. Because if you really look at what's happening, right? You eat a lot of carbohydrates, you fill up your blood with glucose, and then what happens, insulin comes in there, pulls it out, and the pancreas has to really work hard at doing this. And then the next day, you do the same thing over and over and over. Over a period of time, your body is going to compensate by creating what's called insulin resistance, because too much insulin is very, very toxic. And when that happens, now the pancreas gets a signal like, oh, there's not enough insulin when there really is. So it starts making more and more and more to the point where it starts burning out. And then now it can't regulate glucose. And so now you get prediabetes and then diabetes, which is literally 15 to 20 years after this whole thing started. But if you would have tested fasting insulin, or even this right here, you would pick it up. But doctors never focus on that. I want to just tie in A1C. This is like a dashboard cam. So a dashboard cam is a video camera that you could play back information that happened in the past. A1C is an average of 3 months of blood sugar. So it's kind of taking out all the spikes and giving you an average. So let's say you eat really healthy between Monday and Friday, but on the weekends you go off and you start eating a bunch of carbohydrates. You can check your blood sugar during the week when it's great, but if you take the average from the weekends, it's going to drop it down. So basically, an A1C is how much the red blood cell is exposed to glucose. So this really gives you like the 10,000-foot view of what's happening. Now, since we're on the topic of blood sugar, I want to just mention this dawn phenomenon situation right here. What is that? Some people that when they get up in the morning, their blood sugar is high, okay? But they didn't necessarily eat sugar right before that. It's high because either the cortisol is too high in the morning and cortisol mobilizes sugar, or the liver itself is making sugar from other things because the person has insulin resistance. Because the insulin resistance really messes up your liver to the point where it can't really sense things correctly. So then it starts making sugar out of things that are not even sugar or things that you ate that were sugar. So here you are, you're not even eating any carbohydrates, yet your liver is making all this carbohydrate, this sugar, and it's showing up in the morning. So even if you take a diabetic who has severe insulin resistance, 80% of their blood sugar is coming from their liver making a lot of glucose. And that may influence A1C. And so it's a good idea sometimes to measure your blood sugars in the morning. I think what I would recommend if you have this is you want to get rid of the thing that created it in the first place, which is eating too many carbohydrates. If you start going on a low carb diet and you start reducing the need for this insulin, you are going to eventually correct this in relatively short period of time, several months. So it's the combination of intermittent fasting and going low carb will ultimately correct this, a problem with this, lower this, and also correct this right here. You just want to stick with it, keep doing it until eventually you wake up in the morning, you check your blood sugar, and it's normal. A couple other things you could do. You can go for a long walk in the morning to walk off and burn off that sugar. Now, another thing that I know doctors really don't focus on nutrition, but if you were to do a blood test for your minerals, especially potassium or magnesium, or even selenium or zinc, which are also important trace minerals, chances are they're going to show normal in the blood because these minerals are usually not hanging out in the blood. They're deep in the tissues. And so when you're checking the blood, you're only checking a very tiny percentage of where that mineral is, maybe like 1 to 2%, maybe a little bit more with this. And so you're searching for deficiency of something in the wrong place. There are very specialized tests to pick up potassium, magnesium, selenium, and zinc. Instead of going through them in this video, I'm going to put them down in the description so you can get that data if you wanted to test minerals. But typical blood tests don't give you accurate information of what's going on with the minerals. Like even magnesium, for example, which is super important. If you check the blood and it's normal, you could actually be deficient because in your cells where the majority of magnesium is, it could be lowered, but allow a little bit of it to trickle in the blood, giving you the sense that you're normal, but you're really not. Let's talk about number 5, B12. When you check B12 in the blood, you're not just checking the active form of B12, but you're also checking part of the inactive B12. There's another test called MMA test that will pick this up better. And another good one to test this out indirectly would be to check a homocysteine. I will include that down below as well. Number 6, CRP, C-reactive protein. This is an inflammatory marker. And so many people are inflamed. You want this number to be as close to 0 as possible. You want it to be below 1. I've talked to many doctors that will say, well, you know, if you're below 3, you're fine. I disagree because that is an inflammatory process that's going on. And even though the average person has inflammation, that doesn't make it normal. Because again, the normal is basically average, and I don't want to be average. I want to be healthy. If your CRP is between like 1.5 or 2, like let's just say an average of 1.8, that's not good, okay? You don't want that. That is a low-grade inflammatory state, and a couple things you can do to improve this. Through diet, of course, avoid seed oils, avoid sugar, refined carbohydrates, junk food, focus on getting rid of your visceral fat, make sure you sleep better. These are all things that will greatly improve this, in addition to omega-3 fats, which is a natural anti-inflammatory. I like cod liver oil. And then now let's get to number 7, cholesterol. I'm going to do a separate video on this, but cholesterol is something your body makes. It doesn't just equate to a disease. And just because you have high cholesterol does not mean it's a problem, especially if you are on a low-carb diet, because people that are on a low-carb diet, they eat more fat, they're mobilizing more fat, you're going to actually see more cholesterol in the body. And so one really important element of that is to look at the carrier of cholesterol, because cholesterol is not just floating in your blood, it's in a little container that is delivered to the cells and then from the cells back to the liver. And LDL is the number one most confused part of this cholesterol story, because there's actually 2 different types of LDL. And by the way, most people think LDL is bad cholesterol, but it's not. It's something your body makes to deliver cholesterol into the tissues. And so this is why it's really important to do a specialized lipid profile test instead of just a general cholesterol test, because you want to be able to pick up the 2 different types of LDL, pattern A and pattern B. Pattern A is the large buoyant LDL. This is the one that is usually associated with people on a low-carb diet. This is usually the one that's non-pathogenic, because the size of these particles are big and they're floating and they're not invading the arteries, creating inflammation. On the other hand, the pattern B LDL is a small dense particle size which can invade the arteries and is associated with more inflammation and more problem with heart disease, and it's more pathogenic. So you want to do this specialized test to pick up what you have more of. Is it this or that? The way that you get more of this is you go low carb. The way that you get more of this is you eat more carbohydrates. Number 8 is cortisol. The problem with testing your cortisol is on a wave. And if you just check your blood tests with cortisol at one time of the day, you're not going to pick up the whole picture. A better test would be a saliva cortisol where you're checking in the morning, noon, evening, and the middle of the night, so you can get a full picture of what's going on. But of course, it's a pain in the butt because you have to get up in the middle of the night. So there are other tests that you can do to pick up cortisol indirectly. And one of the best tests is a heart rate variability test. Some people have the watches, some people have the bands around the waist, some people even have the rings. HRV technology has come a long way. That measures the autonomic nervous system through the heartbeat. And then lastly, I want to talk about vitamin D. When you test your vitamin D, you're testing the inactive vitamin D in your blood. You're not measuring what's going on in the active form inside your cells. Here's what a lot of even doctors don't know. A very high percentage of the population has what's called vitamin D resistance. Their blood levels look normal, but they're actually very deficient. There's a couple other things you can test with vitamin D to kind of indirectly know if vitamin D is penetrating the cells or not. And the test that you want to do is called a parathyroid hormone test. So if you check your vitamin D levels and if it's normal, and then your parathyroid is high, you can kind of indirectly deduce that I'm probably not getting enough vitamin D, so this parathyroid hormone is compensating. So you really want your parathyroid hormone to be normal. And that way, you know your vitamin D is kind of connecting into the tissues. And this 20 nanograms per milliliter for vitamin D is ridiculously too low. I would recommend at least 50 to 70, but if you're trying to therapeutically fix something, you want it even higher than that.